Actually, the press conference is just about to get underway at Baton Rouge General, where we are standing by to figure out what's going on with the injured there.
I'm Dr. Flip Roberts, Chief Medical Officer here at Baton Rouge General, and on behalf of the doctors, nurses, and staff, first I would like to express all of our sympathies for the family and loved ones of the gentleman whose life was lost yesterday, and for all, as well as all the victims who suffered injuries yesterday. Our prayers and our thoughts are with them all. This morning I'm here with Dr. Deval Advaryu, a burn surgeon here at Baton Rouge General who was on the team taking care of the patients yesterday. We join you again this morning for an update on the patients who arrived at both of our hospital campuses by both air and ground transport yesterday. Since the explosion, Baton Rouge General has received a total of 19 patients, and we've treated and released 15 of those. We still have 4 that are currently in our burn unit. The injuries were generally burn and orthopedic sorts of injuries. The 4 patients who are still here, 1 remains in critical condition, 1 is in serious condition, and 2 are in fair condition. Their families are with them, and there's been an outpouring of concern and prayers for their recovery, which all of us greatly appreciate. Out of respect for the request of our patients' families, we're going to respect their privacy and not disclose their names or any of the particulars of their care at this time. Baton Rouge General's Burn Center consists of a team of physician specialists and surgeons, nurses, physical and respiratory therapists, social workers, nutritional support, pastoral counselors, a full team doing everything we can to restore our patients' health to their previous good health. In coming days, the focus will be on stabilizing airways, replacement of fluids that are lost during the tissue injury from burns, and trying to prevent infection. And we will be closely attending to these patients over the next several days as we attend to their recovery. The Baton Rouge General is the first hospital in the community, and this burn center was established in 1970 as the first burn center in the state, and we have a great deal of experience of dealing with these sort of patients, and Dr. Advaryu and his team are an excellent team to be taking care of these patients for our community. I can take a few questions.
You still have one patient in critical condition. Is that patient acceptable for?
All I can say is that he remains in critical condition, and the next 48 to 72 hours will be very important in our determination of what direction he's going.
Can you say with that patient or any of them the percentage of the burns on their bodies?
Again, out of respect for the patient's families have already told us they really don't want any details of names or particulars of therapy outlined for you guys today, so we'll respect those wishes.
So these were all male patients who...
These were all male patients. These were all male patients who were working at the plant, all the patients that we received.
Are there injuries similar in nature? Are they chemical burns, or can you say that?
The patients who remain with us have burn injuries. The ones that were treated and released had burn and orthopedic injuries in general.
The Department of Health and Hospitals was at one point there was also inhalation and blunt force trauma injuries. Was that?
Well, I think the blunt force has to do with the orthopedic sorts of injuries, and the inhalation injury kind of fits within the description of we're trying to limit respect the patient's privacy rights at this point in time. So.
Is there still a need for blood donations?
Yes, and we would welcome any blood donations. LifeShare, who helps us with our blood supply, will be reaching out to the community trying to improve blood supply to help us take care of these patients. So.
Given the severity of the blast, or given what you guys saw on TV and some of those things, and then compare that to the patients you guys got in, did that surprise you, the 2 jive, or was it more or less severe than what you guys expected, seeing the enormity of the blast?
The injuries look appropriate for our impression of the blast that took place at Geismar. I think that'll be it for today. We're going to get back to taking care of patient care. Thank you so much for your interest in passing this on to the community. Thank you.
Of course, you've been listening to Dr. Roberts there, Chief Medical Officer at Baton Rouge General. A quick recap, 19 patients the General took in, 15 have already been released. Simple math tells you 4 are still there, and they remain in the burn unit, 1 in critical condition, 1 in serious, 2 in fair condition. But he's talked about the burn unit being one of the best around. It certainly is. And of course, we will continue to bring you the very latest here at WAFB, WAFB.com, because it's still continuing. So much more to come.
It's very fresh. Again, 1 fatality to report, dozens injured. We'll be right back with an update from state police as well.